Alrighty, so we have Dr. Almeida in the house, everyone. An internationally well-known vascular surgeon, focusing on vein and wellness. Welcome.
Thanks. Excited to be here.
Yeah, just to kind of kick things off, what kind of brought you to the vein and wellness and your current philosophy in medical management?
Yeah, so I'm a fellowship trained vascular surgeon, and when I went into this traditional kind of thinking, did general surgery down here in Miami, and I came down here. I'm a little older than you, so when I trained, it was the drug cartels in Miami, cocaine, which meant gunshot wounds, which meant great training for general surgery. So I came down here for the gunshot wounds for general surgery, and then became enamored with just being able to control the aorta. And then I went on to do a vascular fellowship, and then when I came back, there really were no vascular groups. So I was solo vascular surgeon covering 8 hospitals by myself. And as you know, the young kid gets all the scraps. So, we're making our life out of the emergency room, and not a great lifestyle. Wife and 4 kids, and I was already getting burnt out at the age of, 39, 40. So I was trying to figure out a way to just do something a little different lifestyle-wise so I could get my life back, and started doing vein stripping in the office with tumescent anesthesia. And just by happenstance and serendipity, that's when radiofrequency ablation 1999 got approved. And I did my first radiofrequency ablation in the office after stripping. And I said, that's it. I'm done. This is where I'm going. I got into competitive bodybuilding. Found a trainer, professional bodybuilder, woman down here. There weren't many pros, but she ended up winning Miss Olympia, the number 1 in the world. So I trained with her, and did 17 bodybuilding shows over the last 20 years. So naturally, that takes me to a fitness mindset, and we started a commercial gym for something on the side, and was a commercial gym owner for 7 years. And what I tried to do with that was convert it into a medical gym, but I bought a building and I couldn't get the permitting that I needed for medical. And now, the building's up, and we just got a Medi Spa, kind of Medi gym here out of my office. So that's kind of fast forward to where I am today. So I do veins. We have a wellness center. We got a lot of modern things going on, from nutrition to devices to, functional medicine, and just kind of get it all with the idea of developing more of a cash practice and getting out of this racket that we call insurance-based medicine, because they're just killing us.
Yeah, so I throughout my short career, I've encountered a lot of doctors who have been trained to be, at the top of their field, trained to the, different fellowship and specialties, but then get burnt out and no longer offer those kind of emergency vascular services. And then, I know that there's a public outcry, there's a shortage of doctors who are offering these services, but it seems like the environment, the political, economic, and social environment is just that it's discouraging doctors to do what we're passionate about, like those, complex aorta surgeries that you've been trained, that you're the expert in. Like, it just doesn't pay. It's not even worth it anymore.
It just stopped making sense. So if you're in private practice now, the numbers I have are about 70% of doctors are employed now by a hospital system or an entity and get a salary. So they don't need to manage the business of their overhead. But if you're in private practice and have to manage your business and overhead, and thank God I have my wife to help me with that, you start figuring out real quickly that these big cases have a lot of liability. So your malpractice insurance is through the roof, and the compensation just doesn't fit the model. So what I realized is to distill it all down, every time I walked in the operating room for a big case, my livelihood was at risk. Because down here, it's very litigious. They sue you for anything. You could have done everything right, bad outcome, doctor's fault, lawsuit. That's the environment down here. So it just didn't make any sense anymore. The compensation, they just keep cutting us. We're losing autonomy. We got to deal with insurance companies and get pre-authorization. They will deny payment, and you got to go to appeals processes. This means you got to hire more staff, more overhead. So you've got a diminishing reimbursement and escalating expenses. The profit margins are getting now where it's very difficult to run an office, and that's where we're at. So I think a lot of us that are seeing this are figuring out different ways to make a living with the skill set that we have, which is medical and not business. You know, trying to be, now you've been very successful with all these businesses, and you know, I'd love to hear more about that. But most of us, you know, zero business training, goose egg, not one class in business. So that's 4 years of college, 2 years of grad school, 4 years of medical school, 5 years of general surgery, and 2-year fellowship. 17 years of school and training after high school, zero business classes. They taught us nothing. So, and frankly, that wasn't my interest. My interest is doing big surgery, and it just doesn't make sense anymore.
Absolutely. You know, I hear nowadays that I think dentists, you know, dentist schools are teaching business of dentistries, whereas in medical schools, I don't hear any medical schools offering the business of medicine. It's become so politicized that you know, what you're saying is true in my experience. Private practices are dead, and only you know, doctors that's going to be continuing to practice are going to be employed models. But the problem with the employed model, I know, is a lot of the employed doctors, I'm not saying all, obviously there's some, don't want to do a lot of services. They want to turn away a lot of patients. I hear from patients all the time, the doctor didn't want to do any surgeries. They just want me to cut off my legs. They didn't want to try. And I think the ultimately patients suffer because you know, we don't have private doctors who are invested in patients' lives due to their reputation and due to their relationships they need to have with the referring doctors. Whereas employed doctors, they don't care. They will just amputate the legs without even trying any conservative method, any medications, any endovascular, any minimally invasive, and just go straight to the easiest procedure for their life.
Yeah, it's a bunch of misplaced incentives right now. I don't know the exact rationale. I suspect it has something to do with RVUs. And look, if I can make these RVUs doing this easier procedure or do this harder one with all this liability, I'm going to choose the easy way out, and the patient suffers. You're right, but it's the corporate. You know, I'm not justifying any of this. Doctors, we have a mission. But the corporatization of American medicine is really destroying all the morale, and it's just destroying the system the way it's run right now. So doctors are under the thumb of the business people. The money is moving away from doctors to the business people. The autonomy is disappearing. It's just not the same as when I got out of training. It's a different world. I'm the son of a physician. His life was very different than my life. He had complete autonomy, private practice, compensated fairly for his services, and it's a different world for us. And I have a daughter in medical school now, so poor thing. I'm not sure how things look for her when she gets out.
I have 4 children as well, and I would never wish medical field upon them for their life. I mean, 17 years of dedications that we had put in, working easily over 100 hours a week. You know, people accomplish a lot more in business, in their financial independence, in their relationships. I mean, doctors are known for broken relationships all the time. I mean, I'm not saying everybody, a majority of them, the relationships get strained because we're training all the time, we're studying all the time, we're working in the hospital 3-4 days out of the week, and cannot maintain family or relationships or anything like that. But I mean, you asked about my story, and yeah, no, I mean, I went into surgery because I love this profession. I love the ability to help people. I was so good at surgeries. I mean, it's just amazing how good I can become in my hand-eye coordinations, in my differential diagnosis in my head, and coming up with the quick decisions to save patients' lives. But it's no longer worth it to me. It's almost like I'm getting punished for being so good and helping people. And when I noticed that, I started shifting to business. I started investing in real estate. I started investing in other businesses and realized, hey, I can be good at really anything. The ability to become an expert surgeon is the ability to learn. And my ability was, hey, I can learn anything and practice to be an expert in any field. And that's what I started doing, learning about finances, accounting, marketing, HR, legal, and hiring people and operating an organization. And after many years of doing that, I realized, hey, I'm really good at this. I get rewarded for it. I can actually help people. And now I've opened up a charity, organized people around it to help homeless people and other people who are in need.
Yeah, you had the interest in it. You had a natural interest in business that, I frankly don't have. My interest was medicine, all in. And you didn't need any business, when we started. It just kind of get into practice, and the rest kind of took care of itself. You did deliver good services, you got paid, compensated fairly, and the rest just took care of itself. But it's a different world now when the profit margins have shrunken to minimal. So
Just to kind of shift the course, I know a lot of patients want to hear from an expert like you regarding how to stay healthy. Now, what are the basics? And I know you're a fitness buff, you're a bodybuilder, you stay healthy, you're still looking like 40s. How do you do it?
yeah, well, I mean, it's what you've heard your entire life: nutrition and exercise. And that's very broad for a lot of people and means different things to different people, but that's the bottom line. So what does nutrition look like? Maintaining a good body weight, trying to eat clean, avoiding processed food. Anything that comes in a bag or a box or a can with a barcode on it, is processed and has chemicals. So really, and it's not practical. You need to be getting your food out of the ground and dusting it off and cleaning it, or a lean source of protein that's clean without hormones. That's difficult to get nowadays. So our food is toxic. I mean, that's just it's abundant. It's toxic. It's easy to reach for. It's not like the old, saber-tooth tiger days. You're in a cave, you went out and killed something, and that had to last a week. It's a different thing. So you've got a bunch of couch potatoes reaching for food all day, and then your insulin levels stay high. Your glucose regulation is out of control. You start depositing fat in the wrong places. Insulin resistance, metabolic syndrome, voila, obesity. And that's, epidemic at this point. Exercise, I mean, all the data is coming out now, which wasn't there, but it's clear now that grip strength or strength, muscle mass, avoiding sarcopenia, skeletal muscle is an organ. And it doesn't take much in the terms of just what you need to do for lifting some weights to maintain skeletal muscle, which is your, glucose disposal organ. When during exercise, yes, there's a stress response as we damage the muscle, but the adaptation after exercise, all the myokines that are released, they're all, healthy. And people think that exercise, okay, I got to become a bodybuilder, 2 hours a day in the gym pounding weights. No, you don't need 1 day a week of resistance exercise for most people is adequate. If you can do 2 days, even better. A 10-minute walk after you eat. Again, muscles are moving, movement. You eat, muscles moving, glucose disposal. insulin comes down, glucose is regulated, fatty acids are burned. Uh, it's just pure teaching your metabolism how to work properly. And that's knowing how to burn glucose and fatty acids, and you need plenty of protein for structural and enzymatic reactions. And that's just bottom line, eating clean food, knowing your baseline calories. And if you want to put on a little weight or a little muscle, you got to go into a little bit of a caloric excess. If you're overweight and need to lose some fat, you need to go into a caloric deficit. And there's ways to do that. But it's exercise and eating correct. The same thing you've heard. It's just as there's a lot of nuance to it on what you want to accomplish. If you want to get on a bodybuilding stage like I did, which is pure craziness, but I loved it, that's 1.5 grams per pound of protein per day that I ate at 200 pounds. So that's 300 grams of protein, which is 50 grams, 6 meals a day. A lot of people can't eat that. So then you learn things like, okay, you gotta, and I would eat the same thing every day. I still do. It's just that I don't eat 6 meals now every 3 hours. I eat, 4 to 5 meals because I stopped competing 2 years ago, and I'm just kind of in maintenance mode, thinking more of longevity instead of getting on stage. But just to illustrate the point, so 6 meals a day, 50 grams of protein per meal, an 8-ounce chicken breast. A chicken breast, you got to chew that. You're trying to do this between cases. A couple of days of that, your jaws are sore. So then you learn, okay, maybe ground beef, and wolf that down with a spoon between cases, a little bit of rice and broccoli. You learn all these tricks. Now that's to put on a bunch of mass in a bulk phase, and then you go through a cut phase before you get on stage where you start chopping it all down. And that looks like dropping your carbs to 50 grams a day, and then managing all the irritability that comes with that. So your family's around you. Who's this grumpy old guy now? Your patients, you're in the operating room and getting a little agitated with your resident. You got to learn how to manage all that, but that's extreme. That's craziness. You don't need to do that for longevity and fitness. You just need to get some protein goals. And I would say minimum 100 grams a day. And because that'll probably get you the leucine that you need, 2.5 grams of leucine per meal to stimulate mTOR, mammalian target rapamycin. That's for protein synthesis, so you can get some muscle going. It's not that hard for me now because I've been doing it for 20 years. But the first couple of years, the first thing was you got to train yourself how to not crave sugar. That was the killer. It's the sugar. And then having a goal, like for me, the 17 years of competing, I knew I wasn't going to become a pro because you got to do all these massive steroids to do that. For me, it was every year I'm going to compete. So I know that I need to bulk up, cut down. The discipline is there. I've got a goal. Okay, it's 12 weeks out. Now I start dropping the carbs, increasing the cardio. It was a routine for me. And then you just turn into this little machine. And then, it becomes second nature to where you don't need even count macros. I had my big bowl off season and my little bowl in a cut phase. I fill this bowl with this much food. I know this is what I need to put on. I get this little bowl and put food in here. I know I'm going to lose weight. It became that simple. You just eyeball everything. But at the beginning, yeah, it's a little tough. And most of it was just getting rid of the cravings. So you eat what you crave and you crave what you eat. After a while, if you're eating chicken breast, rice, and broccoli all day long, that's what you crave. If you're eating, potato chips and Doritos, that's what you crave. So it's a matter of, getting into good habits and sticking with them. But it's got to be the best diet is the one that you'll stick with. So what you don't want to get is all this yo-yo dieting, the next craze diet. They all work, keto, paleo. That's all nonsense to me. It's just getting the macros in, something you can stick with. Get some goals to where you want your body, tuned up for something, a wedding or to fit in a suit or. But for me, it was bodybuilding. And then it just, make it your lifestyle. It becomes your lifestyle. So eating right and exercising is the lifestyle.
Wow.
Long-winded answer. Sorry.
Yeah. No, 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 not at all. We really appreciate your perspective. So you basically kind of use the bodybuilding competition as a goal to motivate yourself to get to this level of consistent discipline, putting in the work with, paying attention to the nutrition and exercise. And now you've gotten to a point where you can just kind of coast and maintain just by doing 30 minutes elliptical and
Yeah.
30 minutes of weight.
Yeah,
That's
the
amazing.
bodybuilding shows was a tool for me. And I got to nationals, Pittsburgh, which is a big show. So there's some big dudes, you get in a lineup with 20 guys next to you, and then, wow, this is how'd I get here? You're not going to win. You're
Were,
training to win, but once you get there, I'm not going anywhere. A
were
lot
you
of
the
it.
only doctor on that lineup?
Oh yeah, a vascular surgeon bodybuilder. I think I'm the only one on the planet. I think I'm the only one.
That's amazing.
Yeah.
What's really amazing is that what I'm hearing from you, when I talk to young doctors who are just coming out of training, I don't hear that at all. All they know is how to push medicine and push surgeries to treat a disease. Whereas an older doctor who's been experiencing a lot, who has treated thousands of patients, I hear nutrition, exercise all the time. Is that kind of your experience?
Yeah, absolutely. So just vein patients, a lot of them are overweight, a lot of them, and just having a big abdomen, as you know, puts. So when we talk about venous hypertension or high vein pressures that can come from reflux or obstruction, a big abdomen is what we call now boundary condition. So the vena cava is floating up to the heart through the abdominal cavity and has these organs on top of it, causing compression of the vena cava, which is now causing functional obstruction and venous hypertension in the legs. So many of these obese people come in with lipodermatosclerosis in both ankles, and you
Mm.
ultrasound them and their veins are normal in the legs, but it's the belly and the venous hypertension in the abdomen. So the treatment there is weight loss. Of course, you got your jokers out there. They're going to do saphenous vein ablations, bilateral great, bilateral small, and ching ching, collect their money and not, but that's what the patient has. We see that all day long. The problem is, us conventional physicians, and this conversation, starts another thing that starts getting a little unfair. I mean, we got to see all these patients to make overhead. So how much time do I really have with an overweight patient with venous disease to sit there and counsel them for an hour on this conversation we're having now? I don't. You got 5 minutes. This is what
Yeah.
nutrition and weight loss. Now, if you want to get into our wellness program and come back for another visit, which is, we can go through all the things and the new tools, the GLP-1 agonists. We've got all these other things in the office for the wellness side, but just a straight vein practice, talking to people on how to lose weight, you can't do it. It's the same thing with primary care docs, these YouTube community, all the biohackers out there. Well, these doctors are just pill pushers. Well, these poor primary care docs got to see 60 people a day to make overhead. They got 5 minutes. So, somebody comes in and with high blood pressure, you're not going to go through the whole diet at what needs to be done. Here, man, here's your antihypertensive. Don't have a stroke out the door because then I'm liable. That's how it works. That's just, we've been boxed in by the system. So until we make, more time for ourselves to counsel patients properly, which to me means we got to get out of this insurance. We got to get the third party payer out of the loop here. They've just dominated the whole conversation and the whole system. So if there's a way where we can get back to a patient doctor relationship, spend some time with them and get the third party payer out of the loop, we can get back on track with this. And that's going to be mostly the wellness conversation about diet and exercise.
Absolutely. Yeah, I think a lot of physicians are, practicing their medicine based on the incentives. For example, it's a lot easier to push medicine, prescribe Ozempic, prescribe amphetamine, rather than working on weight loss, which may take a year or two of regular visit, regular counseling, regular coaching and mentoring and motivations. because it is infinitely a lot harder to lose weight than to just simply prescribe a medication and say, come back in, 2 months.
So you said the word there. We need health coaches in our practice that can do that. The piece that requires sitting down and talk to them about how to do all this stuff, all the practical things of, what to have in your refrigerator and when to walk, all the practical things that go with a healthy lifestyle. It's very difficult for a lot of people, and it requires a health coach, which physicians don't have time for that.
But the nutritionists are not any better. They're educated and trained to say, oh, eat more carbs and only a limited amount of protein. Whereas what you're talking about is balance. Like, hey, you need a lot of protein to maintain your muscle mass and healing abilities. Yet
It
at the same
depends on the
time,
nutritionist. So, so like sports nutritionists, they're in line with everything I just said. Maybe the only controversy is, how much protein. You got your vegan people and your plant-based people, and then your animal people. It gets in religions, and it gets crazy.
Yeah.
But to put on muscle, you got to eat some protein. To stay healthy, you got to eat some protein. I mean, protein is, it's a structural. All your enzymes are proteins. All this, the structure. I'm preaching to the choir here, but protein is the key. But it's not an energy source. So your energy sources are carbs and fats, and your body's got to, be tuned properly to metabolize them properly. Eat too much protein, then you can burn. What's going to happen? First thing is going to go to the liver, get deaminated. Then the carbon skeletons are going to go into the Krebs cycle, and it's either going to become fat or sugar. So too much protein is bad if you're not using it properly. Too many carbs, same thing. Glycolysis to the Krebs cycle. If you're not burning it, it goes over and gets stored as fat. But I think there's good information on how to get things tuned. It just, you need to pay attention to it. You need to pay attention to stuff if you want to stay healthy. And eating processed food is the environmental toxins are everywhere. You can't avoid them. So we're all poisoned.
We won't even get into the GMO aspect of it, but.
Yeah, I mean, your liver's got, if your liver can't detoxify all the stuff that we're dealing with daily, you're going to get sick. So, that's what functional medicine is about, learning how to detox and what supplements to take. And that's all based off lab testing. There's now some nice organic acid testing. You can do it with saliva, with blood, with urine. There's all kinds of salivary cortisol testing to check your stress levels. The functional medicine piece is a real cool piece to all this. Been doing coursework in this for the last since 2018, and just getting more and more into it. So my wellness practice is a combination of conventional and functional, and just trying to piece them together. So it's not one or the other; it's one and the other. So there's a role for function, and there's a role if there's disease, to deal with that the conventional way.
And I think that kind of balanced approach to medicine and health is what's needed. What's your website address?
So Miami Vein, VEIN.com is, my vein practice. And we're now kind of rebranding to Miami Vein and Wellness, because we have Miami Skin Spa, where our Medi Spa is. We have Miami Ink Off for tattoo removal. I used to have Midtown Body with my medical gym. So all these things, and now we're just trying to get it all to come together to Miami Vein and Wellness. So for right now, it's Miami Vein, and we're getting the wellness, with the functional medicine all tuned up, so it's clearer for patients on the website.
Yeah, hearing your story kind of reminds me of my story. I used to have these knee pains, severe knee pains all the time. Obviously, especially worse after standing for 12-hour, surgery cases, whatnot. And I went to go get an X-ray done. My cartilages are fine, and they just said, "Oh, it's arthritis," and I couldn't understand it for my life. At that time, I was abiding by what's in the public about, avoid eggs, avoid meat, minimize a lot more sugar and carbs. And I did that, and it didn't work. I couldn't figure it out. My cholesterol level was through the roof. My LDL and triglyceride levels were high. HDL levels, rock bottom. I couldn't understand it. But when I changed just a few things, like I started actually just saying, you know what, forget this. I'm going to, no matter what the pain is, I'm going to start walking. And once I started
Yeah.
walking 30 minutes a day, an hour a day now, it's gotten a lot better. I started eating eggs, started eating more steak and protein sources in a balanced way, and a complex carb that doesn't
Yeah.
just spike my sugar. I
Yeah.
think it's the sugar that really caused a lot of inflammation in our body, joints and arteries and veins and everywhere else.
Sugar's poisoned.
Yeah.
And there's MRI studies showing how the addictive properties of sugar are equal to cocaine. It is super inflammatory, uh, does not get metabolized properly, and it's not surprising you're a sugar addict that you had all those problems. And then weaning off of sugar, that you start feeling better. That's not a surprise at all.
And how are your labs? How are your cholesterol levels, your blood work, and how your,
So
CRP,
everything was great
inflammatory
till
meat?
I hit 60, and now my cholesterol started tweaking up, even doing what I do. So I had to start a statin last year. I got a little bit of plaque in my carotids. My coronary calcium is 1.4, which is very low, but it's not zero. Well, coronary calcium is zero, and then there's a stepwise function of anything that's not zero. So 1.4 is very good, very low, but it's not zero. So there's plaque in my coronary arteries and my carotid arteries, and I'm 60 years old. I need to start paying more attention to that. So I didn't want to start on a statin, but I'm on one. Yeah.
Yeah.
And that's doing all the right things. So I mean, I can't control my genetics. We got some of that in the family. So you know, can only
Yeah.
do what you can do for longevity. But probably if I hadn't done all these things, it would be worse.
Absolutely. I think it just goes back to your idea about the balance in life. Yes, some genetics will influence our um, inflammation and cholesterol levels, but there's so much more that we can do in terms of diet and exercise that can help us decrease the inflammation. Because what we know in medicine is inflammation is one of the biggest killers. Inflammation of the coronary arteries, inflammation in your gut, inflammation after the bacterial sepsis, inflammation
Yeah.
in your joints, getting unnecessary joint replacement surgeries, all because of the inflammation.
Yeah. Well, that's I don't know if you want to go. That's a little piece. You mentioned doctors and the relationships before. So there's all kinds of stress. We're stressed all day long. Emotional stress
Mm.
is one of the killers. A bad marriage, bad breakup, a death in the family. That
Tell me
emotional
about it.
stress just smashes your cortisol regulation. How did I start? Waking up at 4:30 in the morning. So the first thing that I did was that little thing that goes off in your head when the alarm goes off. Go back to sleep. Hit the snooze button. So the first thing before all this was controlling that voice in your head. So to me, is discipline means giving yourself a command and following it. And then you start building on that. And success begets success. So you start doing one thing well, you can add something else. So next thing you know, you got this life crammed with all these pieces. So people look at me and, how do you do all this stuff? Well, I put it together one piece at a time. That's how.
Yeah.
Started this a
Yeah.
long time ago. I'm 60 years old now. I've been doing this for, hitting weights for 45 years. So piece by piece, brick by brick.
I think a lot of people, when they hear your story, it's like, oh my God, I can never do that. I think the key to remember is just take one thing and start implementing it day by day, week by week, month by month. And then 6 months goes by, it becomes habitual, it becomes easier. And then
Correct.
now you can add extra proteins or meal plan or preparing all the healthy meals beforehand. That's a habit as well. And I think
That's
when I think one thing that people can take away from this is just pick one thing from
yeah.
what you're doing and start implementing it and see how the life changes. That happened to me. Starting to eat more eggs, starting to walk first before running. Now I could run with my
Yeah.
knees that used to hurt so much that I thought I had to get knee replacement or arthroscopy or something done. It was all in my mind. It was all the inflammation from sugar and everything, all the junk that I
Yeah.
was putting in my body. Drinking too much, cigarettes, whatever it is that was
Yeah.
harmful to me. It took me step by step to get out of those habits to put in the new habits instead. All right. Well, thank you so much for all your talk. I mean, is it
Yeah.
okay for people, listeners, to contact you, ask for your opinions and advice and email you on your website?
Yeah, sure. You can direct them to the website, miamivein.com.
Or people can just search your name, Dr. Jose
Yeah, if you
Almeida.
Google Jose Almeida, I'm all over the place on
Yeah, Miami
Miami
Vascular
vein,
and
varicose
Wellness
veins.
Surgeon.
Yeah, Miami vascular veins, Jose Almeida. You'll find me on Google. Yeah.
Because I think, a lot of people would benefit from your wisdom and experience because, you're unlike a lot of information sources that could just be a quake, like a fake, trying to sell nutrition and vitamins. Your advice comes from your years of training and actual hands-on experience of treating people, doing surgeries, and making them better and making yourself better as well.
Yeah, it's real world experience. So yeah, that counts for something.
Awesome. Well, thank you so much for your time, and we really appreciate it. And the listeners can search on Google, Dr. Jose Almeida, Miami, vascular and wellness surgeon, and ask me for any advice and what they need.
Yep. Have a great Labor Day weekend. Thanks a lot.
Awesome.
Enjoy it.
You too. Take care. Okay. Have fun with your children. You're
Thanks.
blessed.
All right.
Take care.
Bye.
Bye-bye.